Hi, I'm Dr. Alan Mendelsohn from Eye Surgeons and Consultants in Hollywood, Florida. Today I'm going to talk about styes or Chalazion. Chalazion is spelled C-H-A-L-A-Z-I-O-N. Infections to the eye are very common. They can be caused by viruses, bacteria, rarely but occasionally fungi, different things. And the infections to the eye can at times involve the eyelid as well. Most of the infections can be treated with drops, ointment, and clear very, very quickly. Of course, corneal ulcers are much more severe. That'll be a topic of another YouTube video, but the vast majority of infections clear very quickly. A problem arises, though, when the bacteria go into the glands of our eyelid. So we all have glands in the upper and lower eyelid. The glands are shaped just like a piano key on a keyboard. They're called meibomian glands. We all have 25 meibomian glands going across the upper lid and 20 meibomian glands going across the lower eyelid. When the bacteria go into the meibomian glands, they fill up with pus and we get elevated bumps. So if you look at my right upper eyelid, you'll see it's red. It's swollen. You can see the gland has become elevated. It's infected. That is what is a chalazion. So the chalazion that I have in my right upper eyelid actually is the very first in my entire adult life. I'm 59 years old. And despite being an ophthalmologist taking care of patients for 30 years with infections and inflammation, again, it's the very first time I'm developing one. So for most infections and inflammation, drops and ointment, all that's required. But when it actually gets into the gland, like what I have with my right upper lid, we need to add oral antibiotics as well. So currently, I'm on oral antibiotic, I'm on drops, I'm on ointment, and very rapidly, my left upper lid cleared, my left lower lid cleared, my right lower lid cleared, and the reason they cleared very rapidly was they were not clogged in the glands. But my right upper lid is a slowpoke because it's clogged in the glands with that chalazion. From my experience, about 98% of the time, the oral antibiotics, the drops and ointment will clear these up. Sometimes they can be slow pokes, take 10 days, 2 weeks, but nevertheless, usually they'll clear. For the 2% of the time, when the medication alone is not sufficient, what we will do is they should be incised and drained. But so here I am with my very first chalazion of my entire life, but luckily the medication is working, but I just wanted to give an explanation and demonstrate on my own right upper lid. Thank you very much.